Hi everyone, this is Neel Raithatha, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral blocked earwax and dead skin. And this patient initially visited their pharmacist because they felt their ears were blocked, but they were advised, not with the left ear. I think the left ear they were told that they have got wax, and they were recommended to use carbamide peroxide drops, which is a combination of urea and hydrogen peroxide. But in their right ear, they were told that their ear was clear, there was no wax, and the eardrum was visible, but it was really red. And they were advised to use Ear Calm, which is a spray available in the UK. It's acetic acid. It's designed to reacidify the ear, and sometimes it can help with a condition called otitis externa, which is it's an umbrella term which encapsulates an infection or inflammation of the ear canal. But as you can see, they've got wax both sides, not just in this left ear. So I'm starting off with the left ear, and I'm not a big fan personally of carbamide peroxide drops because the urea contained within turns the wax really mushy and sticky, and it not only hard to suction, it can block the inside of the suction tube, but it tends to stain the ear canal and eardrum. So the wax in this region is in a region called the anterior recess. I'm just using the fine end suction probe, and in a moment you're going to see quite a lot of wax taken out of this, much more than what it appears, because there's a little hidden cavity in that region, and also at the bottom of the ear canal, just in front of the eardrum. So just a bit of this wax on the eardrum, so we're going to take this away as well. Again, we're just using the fine end suction probe, so it's smaller diameter, but it is less powerful, but it's also less noisy. And when we work delicately in the eardrum, I always prefer to use this to minimise noise level and potential trauma. So we're just kind of peeling that away. There's a little bit on the umbo, which I'm going to also get in a moment. But I think I'm just going to go back now to the anterior recess. I'm just stretching the ear canal open a little bit more so we can visualise inside that cavity a bit easier to make it more exposed. And you're going to see in a moment, it did surprise me a little bit actually, but it shouldn't do, because nothing should really surprise you when it comes to the ear. So you can see there's quite a lot hidden there. It's just blocked the suction tube, so I've just come out, unblocked it, I've just gone back in. And there's just a little bit left there, so just going to mop that up, and then I'm just going to remove that a little bit off the eardrum. Patient was really still, felt comfortable doing it, so, and it's sticky, it's worthwhile if possible just to take that away. Sometimes it's not worth while, because we know it's going to be a bit tricky to remove. You can see this is kind of slid away. There we are. And that's the patient's eardrum, which otherwise looks healthy. So you're going to move on to this ear. So in this ear, they didn't use any drops because they were told there's no wax. Instead, they used Ear Calm, but the patient wasn't convinced because they could feel, sense there was a blockage of wax, or in this case, a lot of dead skin. So it's a lot drier. Just dilating open the ear canal, and there's a bit of skin attached at the top. So I'm just gonna peel it down and away. And then I'm just gonna just change the focus there so we can see this wax and dry skin that's on the eardrum. I'm just going to extract, there's a few hairs matted to it. And I'm just now working on the back part of the ear canal. So I'm going to stretch open the ear. This ear, it was also a bit itchy for the patient, so it was worthwhile trying to remove this dead skin for them. I'm just going to peel it down and away from the canal wall. And when you have dead skin, it's highly reflective, so because it's all the keratin, which is a protein that's also found in our hair strands and nails. Now, there is going to be a little bit of skin left on the eardrum, but because it's really dry and crusted, I decided to leave that. On the left side, it was softer, so it was going to come away a lot easier. But you can see it there, and it's just not worthwhile trying to remove that. That's the patient's eardrum. Looks, again, nice and healthy. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.